getting started. And hold on one second, Facebook. Okay. All right, let me get situated here and we will get started. Oh, don't want these sneakers on. Okay. Let me just adjust for a second here. I'm going to try to... Now I have the cameras like stacked, so hopefully that will be a little less awkward with me like completely not looking at somebody. At least I'm kind of looking at somebody. And I still have allergies, so that's always fun. All right, I'm going to take this laptop over there just in case. All right, folks, so let's get started with tonight's COVID-19 update show. I wanted to, let's see, oops, what's that doing? All right, guys, so let's have a little bit of fun tonight. I don't know if you can hear that, but I can, so it's going to put me in a good mood. Now, what the heck? I thought it would. Before we get started, just real quick, tomorrow is going to be a little bit less heavy topics because, okay, I went through and I figured out songs that you can sing in your head for 20 to 30 seconds while you wash your hands. So I busted out my old DJ CDs. Yes, that tells you how old I am. And we're going to do that tomorrow. So that's not all we're doing tomorrow, but that's part of it. All right, let me get my notes up on here. Lots of stuff to go through tonight. Lots of questions. Lots and lots of questions. So, all right, let's see here. So on tonight's live, I'm sure you saw the list. We'll go over today's White House and New York State press conferences. Now, the New York State one is going to be a little bit rough from me because, unfortunately, not only did I run out of time, but when I was trying to kind of cram last minute about the New York State press conference, my internet was behaving wonky, and sorry, that's probably because I had like 12 devices right next to me trying to like coordinate all this. So I'll tell you kind of what I do know, but if you're in New York State, a better source for that information today is not me. I'll just be honest about it. But I'll kind of talk in general terms about it. And of course, relatable terms, like I always do. So these things that are being thrown around, like anecdotal and immunity, like we talked about the other night, the difference between wellness immunity and COVID-19 immunity, they are not the same thing. That's one of my pet peeves about this. And I don't blame Dr. Fauci. I don't blame the doctors at all, because this is like old hat to them. They've been doing this for how many years? So to them, when they say a word, they know what it means, but it doesn't mean everybody else does. Like anecdotal, like immunity, like ventilator, like mask. A lot of people confuse ventilators and respirators, so I'm going to go over that tonight. There's an IgG immunity test sponsored ad going around, and my allergies are getting me again. So I'm going to talk about what is an IgG immunity test. Because I recently had one and I have my results here, and I'm going to explain what IgG is, what it does, and why you absolutely should not get an IgG test right now. In fact, I am begging you, begging, do not get an IgG test right now, and I will explain why later. All right, what else? There's a new POC, which is point of care. POC in this context means point of care. That was my abbreviation. I know they were calling it point of care earlier, but I was trying to save space on my list because you can't see it. Sorry. But there's a new point of care COVID-19 test. I'm going to tell you what I know about that, which is very basic stuff. In fact, I didn't have a whole lot of time to go back and review what they said in the press conference. So I did find an article about it that I will quickly go through and kind of translate what they're saying. And like I said, your many questions. So, all right, if you're watching this on my personal Facebook page, feel free to go over to my YouTube channel, which is Pain Warrior USA Hacks for Fibromyalgia. Yes, I know it's a terrible name, but I have been so busy since this COVID-19 thing started, and I've had the YouTube channel for a while, haven't done really anything with it. And I thought, wait a minute, YouTube has a huge base of people that come here. They do recommended videos. I can get to a lot of people, and it's a relatively easy thing to stream on, just like Facebook. So I'll add it. But yeah, so you can go to your YouTube app and you can paste in that link that you saw earlier with the tonight's live topics post. So if it's easier for you to watch on YouTube, I actually recommend it because it's nice. It will, if you set a reminder, because every day I set up the event in YouTube. So a couple hours before I plan to go live, there'll be an event in YouTube. So if you go to my YouTube, you can ask to have a reminder set and it will tell you when the event's about to start. In Facebook, obviously, you get a notification when I'm going live if you're one of my friends. If you're not and you're stumbling on this, feel free to follow me, send me a friend request. Honestly, I'm just approving anybody who sends me a friend request right now, as long as it doesn't look like they're a dangerous person. Let's put it that way, because I just want to get this information out to people, because there's a lot of scary stuff going around. There's a lot of misinformation going around. There are a lot of medical terms being thrown around that people are not familiar with. You know, I didn't introduce myself tonight. I apologize. I just kind of got going. My name is Ginger. And I founded, well, that's my name. I founded Pain Warrior USA, which is a chronic illness and chronic pain educational organization. And I have done speaking at several events around the country at different expos. I've spoken at cannabis expos. I've spoken at a dispensary in New Mexico. They invited me to come and do some seminars in a hotel close to that dispensary to kind of explain chronic pain and how cannabis works with it. So I've done a lot of speaking about fibromyalgia, about alternative therapies, about hemp, CBD, cannabis, and I've also been a patient for about 25 years. So these are all terms that I'm familiar with. So I thought this is a way that I can help right now, is to come on here and kind of translate what they're saying in these press conferences into like relatable terms that everyday people can understand. So let's get started. By the way, we are 6 days into the 15 days to stop the spread. So let's just keep doing what they're telling us to do, and on day 16 we'll be out of our houses and things will be back to normal. If we don't do what we're supposed to do, then this virus will continue to spread. And I'm outside of Phoenix right now. We do not have an order to not, leave our houses. People called it shelter in place yesterday. It is not shelter in place in New York City, New York State. Shelter in place would be, an example would be, there's an atomic bomb about to be dropped. Stay in your house. Good luck. We'll let you know if and when you can come out, if we're still around. That's my understanding of shelter in place. So it was not shelter in place, but just we're not at that point yet, because the cases here in the county that I'm in are not too bad. Last I checked, we have less than 100, but the county next to me, which is where most of the population of Arizona lives, much higher. So we are not at that point yet. Personally, I don't want to get to that point. So if you guys can help and do what you're supposed to, so I don't get to that point, because I would do it for you, please. Okay, so yeah, we're 6 days into the 15. Let's keep going. One of the things they said in the White House press conference today was, this is the first time that the Stafford Act has been used in U.S. history for a major disaster in response to a public health crisis. And that was, in reference to the state of New York. Now, some of you are not familiar with the Stafford Act, but I know some of you have heard it before. And I've heard it before, obviously, but I was trying to think, when was the last time I heard it? There was an episode of House of Cards in 2015. See, I'm trying to make it relatable. And Frank Underwood used the Stafford Act to take federal funds to try and lower the unemployment rate in Washington, D.C., because he was calling that a disaster. So that might be where you've heard the Stafford Act before. Yes, it's a real thing. The latest, incarnation of it was passed in 1988. And that's basically what it's meant for. There's a major disaster, it can be invoked, and then the benefits of that act can be used. So yeah, you probably heard Frank Underwood use it, and if you've watched House of Cards, you know that he's a little bit on the squirrely side. He likes to kind of get away with things, but that's where you heard it. So obviously you guys have probably heard by now. And by the way, I don't talk numbers too much if you're new here. I don't talk numbers of cases. I don't talk numbers who have passed. I don't talk numbers really who have recovered, except last night, because 87,000 people recovered worldwide. That's important stuff for us to know. It's important for us to keep hope. It's important for us to understand there will be an end to this. But yeah, I mainly talk about the medical stuff and the scientific stuff that I understand based on my experience, but I will go over some of the things. Now, this is not an exhaustive list. This is not all the information you may need. So if this sounds like something that you want to know more about, look it up, okay? So our tax deadline is not April 15th. It is July 15th now. And this is not really something I needed to know, so I kind of was listening to other stuff and taking notes on other things. But if you owe money or something like that, you might want to look into this to find out. I know that there are no penalties on that money owed right now, but you might want to look into it to get all the specifics and if there's like a dollar amount limit and all that stuff. But so it's July 15th now to file your taxes, so that's a good thing. I mean, nobody really likes to file taxes, and if we have more time to put it off, that's probably not very American to say, but I did anyway. HUD is stopping foreclosures and evictions for the next 60 days if you qualify. If this sounds like something that is in your realm of experience, your wheelhouse, is part of your life, please look into it, because I don't know any more details than that. I just know there are certain qualifications. It's for 60 days, and it has to do with foreclosures and evictions. The standardized testing will not be enforced in schools right now because of this situation. And with student loans, if you have a student loan right now, there's something for 60 days going on. Honestly, I didn't quite understand all of it. My understanding was it had something to do with the interest, but I don't know if they've tweaked that. It sounded a little bit different to me than it was yesterday. So if that's something that you want to know about, look it up. They did talk about student loans, so all right. There was some kind of cool stuff that they were talking about. You know, everyone is talking about, well, you invoke the Defense Production Act and you're not doing anything with it. All these reporters keep saying that. And so far, from what the task force is saying, is that they haven't needed it. American corporations have stepped forward and said, hey, like Hanes, you all know Hanes, they make underwears, they make t-shirts, they make all that kind of stuff. They said, hey, we can step forward and retrofit our factories to make these masks that we so desperately need. So, what does that say? Oh, that was another note, sorry. Distilleries are stepping forward and using the alcohol that they have to make hand sanitizer. That was a kind of cool thing, I thought. I'm going to try to say, I think this is like, it would be like one step above Jack Daniels or whatever. It's like I don't want to say parent company, but it seems like it's kind of above them, because he didn't specifically say like the Jack Daniels distillery. He didn't say like anything like that. But Pernod Ricard, I hope. Pernod Ricard, they are sending hand sanitizer to various states within the next week. So that is awesome. So people who are complaining, well, you invoked the Defense Production Act, you're not using it. We haven't had to yet. And that's an incredible thing that companies here are stepping forward and doing what they can. If you have allergies like me and have to wipe your nose, I apologize. If you are a sewer, one of my good friends on here from high school, she has a shop and she sews stuff herself. So if you are a sewer, a seamstress, if you're interested in that, there's a post on my page today about making reusable masks for healthcare workers and for those who are immune compromised. So you might want to look into that. Now, there are specific requirements that have to be met with that regarding materials and certain seams or bindings, whatever it's called, I'm not sure, that you have to make. I don't know if they can be hand sewn or not. I'm trying to find that out, because if they can be hand sewn and someone can hook me up with the elastic and the stuff that goes in the middle that I forgot what it's called, but I think there's an F in it, the fabric on the outside, I think I have some elastic, I'm not sure. I have to see. But if they can be hand sewn, I will help with that, and I will update that post if they can be hand sewn. I don't know for sure yet. Now, as far as medical staff and healthcare workers using these masks, If you know somebody personally in your life that's a nurse or a doctor or whatever that's involved on the front lines of this, you can ask them if this is something they can use. Otherwise, I know people who are immune compromised, they cannot get disposable masks right now. I've heard from so many people that can't get them. So I would offer them to people you know that are immune compromised first. You can just you can share the post from my wall. I would just make sure that you copy the text that I put and then do the share, because sometimes the description that you put in a post doesn't always come through, and I don't understand how Facebook figures out should we include the text or not. So then you can go back, open the post, see if the text showed up. If it didn't, you can just paste it and then save it, and then you're good. But yeah, that's one way that we can try to help out right now. So again, if you're a seamstress, or if you're a healthcare worker watching this, or you know someone who is, or you're immune compromised, or you know someone who is, go ahead and post a comment on that post that I put up if you would like to, and then maybe we can kind of connect seamstresses with people who need them. But yeah, so that's about the Defense Production Act. It's incredible that we have it. I don't honestly know if it was called the Defense Production Act in World War II, but if you want to understand what putting something into motion like that would look like, perhaps, even though that was for a war, it'll just give you an idea. Okay, well, hey, this factory that made this actually changed to make this for the war effort. So that'll give you an idea of the war, or the Defense Production Act. And YouTube has every kind of video you could ever want to know about. So search there. I'm sure you'll find it. And then you can kind of understand what they're talking about there. Now, I'm going to try on Monday. This is not part of the press conference. This is just a marketing client of ours. I'm going to see if on Monday, a gentleman who, and I had to write this down because, yeah, I don't usually work at this level for the writing and editing and proofing and stuff, because it's a long time ago that they needed that wording. I do like the everyday kind of stuff. But anyway, they're an automation robotics integrator. I got it right. Automation robotics integrator. And basically what they do is they use robotics and machinery to make jobs safer. So I'm going to see if on Monday he would be willing to kind of give me a couple sentences about, hey, they're talking about these companies retrofitting their factories to make different things, but they're not 100% different. So can you kind of explain, so I can explain to people what that entails, you know, what that looks like, what is the effort behind that. So we're going to see about that, and I'll tell you a little bit more about that company Monday. It's really fascinating. You know, a lot of people think robotics, machinery taking away jobs, but actually what these folks do is they make jobs safer for people who are already doing them. That's part of the benefit that they offer. So I'm going to see if on Monday, because we have a call with them, I'm going to see on Monday if they'll give me some information about retrofitting factories, because I think that's pretty fascinating, especially if they know any information about how you can go from making like maybe whiskey to making hand sanitizer, because I know alcohol's a part of both, but I'm not really sure how that works. But it's kind of cool, right? Okay. Next, the National Response Coordination Center is at level 1, just like FEMA. And what they do, it's like the nerve center of the response to crises, whatever it is, in the U.S. So that's at level 1. FEMA's at level 1. Everybody is like busting out everything that we have in this country to fight this stupid, infectious, disgusting, nasty, horrible, mean virus. Like I said, man, it's single, it's ready to mingle, and it's not being like discreet, and it's not being selective. It's like the end of the night at the bar. Let's go. I'm sorry. Was that too much? I'm sorry. Oh, like you haven't been there. I certainly haven't. Okay, so now they're talking about telehealth too, and telehealth has been dramatically extended in this country. I explained yesterday what telehealth looks like. One of a number of great questions that I got yesterday was, okay, it's a telehealth appointment. How is my doctor going to know I have a fever? Well, Just to recap real quick, because it might be information you need. First of all, they'll ask, have you taken your temperature? If you don't have a thermometer at home, there are other symptoms of a fever that the doctor will ask you about. I'm not going to sit here and pretend that I know all of them, but I can tell you with me, I get a really bad headache when I have a fever, especially if I'm lying down and then I go to sit up, or like if I'm sitting and I go to stand up, or if I'm sitting and I put my head down, my head is like, doom, doom, like it's like a migraine. Doesn't even compare to what I get in terms of head pounding. Also, I just feel uncomfortable. Sometimes my skin, and I have allodynia anyway. Allodynia is like, it's not sensitive skin, but it's like your skin is sensitive to things like seams and zippers and stuff. But when I have a fever, the allodynia gets like ratcheted up. So it's almost like things are always scratchy, things are always pokey and burny and just not fun. Of course, when most people have a fever, they don't feel like eating. They don't feel well. Oftentimes, they'll have GI upset, vomiting, diarrhea, the whole nine. And by the way, we're going to talk a little bit more about diarrhea later because it was added to the potential symptoms list of COVID-19. And one of the questions I got was, wait a minute, a couple of days ago, they said that that was rare. You put up a matrix and it said that that symptom was rare. So why are they saying now that? I'll explain all that. So from my perspective anyway, again, I'm not a scientist. I've just been sick a lot over many, many years. So I've learned some things. We'll put it that way. A lot of good questions tonight, by the way, seriously. If you're just watching, I've been talking about 20 minutes. I'll get to the questions later on, but seriously, you're going to want to hear some of these and the answer. There were a couple that I was like, oh, okay. And then Vice President Mike Pence got up and, by the way, when Trump went to introduce him, he said, Vice President Pence is not sleeping a lot. And like I posted the other day, I'm sure they're not. I'm sure they're not sleeping enough. I'm sure they're not eating enough. I'm sure that the toll on them is unimaginable. I mean, the only thing that I think would compare to it is, and I know I have some nurses and doctors as my friends. I know one was on. I don't know if he's still on now. Mad respect for you, dude. Seriously, mad respect for you. I've always had it, but I mean now, So the only thing that I can liken it to based on my knowledge of certain things is, an ER doctor who's on, like, I don't know how long their shifts are, but I know they're a hell of a lot longer than 8 hours or 16 hours. I know they're on for like a ridiculous amount of hours and then off for like 4 or 8 or whatever the regulation is, and then they're back on, and they have these like 3 or 4 shifts in a row like this, which is not 3 or 4 days for them. It turns out to be like 6 because of the number of hours they're on and then off. That's the only thing that I can liken all of the task force and all the work they're doing and not sleeping and not eating. That's the only thing that I can liken it to. So they're really doing a lot and not going on a whole lot more than adrenaline from what it sounds like. So we all owe them a lot, and I hope that they're staying healthy and taking care of themselves. And I hope that they don't get sick, because you gotta rest, you gotta eat, you gotta take care of yourself to keep your immune system up. So if by any chance any of them are watching this, take care of yourselves, okay? We need you. You're doing a damn good job. Very proud of you. Okay, so Vice President Pence talked about testing is expanding. We're going to talk about testing later because somebody kind of got pissed off and sent me a question about, we all need to be tested. Why aren't we? Blah, 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 and went on and on. So we're going to talk about that. Spoiler alert, we should not all be being tested, and I will explain to you why. But testing is expanding, and as testing expands, there's going to be a lot more positives. Know that now. That does not mean that things are getting grim. That does not mean that this is like The Walking Dead come to life. I don't watch Walking Dead. I can't stand that noise. But this is not going to be Walking Dead come to life, okay? As more tests are available, more people will get tested, more positives will come. That's just the way that it works. So don't panic if you see big numbers, at least for the next couple days. I know that some labs still have a 2 or 3 day backup, and then more tests are going out and more areas will get testing. For example, around me in my county, there is no testing yet. It's not that you can't get tested, but I'm so sorry. Let me back up. There is no drive-through testing yet. If I did have symptoms, I would call and again, I said this last night, okay? Remember this. And I'm going to try to share that video that I mentioned last night with a woman who went through the drive-through testing, and she made a Facebook video about it. So informative, so awesome, because it takes away the fear of that process. I'm going to try to show it. I don't know if I can. If I can't show it tonight, I will show it tomorrow night. But, so yeah, we don't have drive-through testing right now in my county or in my area. I don't know if the closer to Phoenix has any, but if I did have symptoms, or you did have symptoms, the process would be call your doctor, tell them that you have certain symptoms. They will probably tell them your certain symptoms, I should say. They will probably ask you, do you believe you have been exposed to COVID-19? And then answer yes or no. And then depending on what your doctor determines, there will be a lab order called to the testing center for COVID-19 testing you need to go to. It's just like any other lab work. If you've ever had blood work for a CBC or your hormones or thyroid or whatever. By the way, I'm going to show you my lab results for my immunity test that I had to a certain thing a little while ago. I'm going to explain how that works, because that IgG test, get your IgG test now, post that's going around social media, shouldn't do that now, and I'll explain why, but I'll explain what it is. So if kind of the pressure on labs dies down and you want to get it, you can. But anyway, so your doctor will call in to whatever testing center you are to go to an order for a test, and then you go where they tell you to go. You do what they tell you to do. It's 3 swabs. They're going to go digging. Be ready now. Have you had a strep test? If you have had a strep test, from what I understand, the throat swab is very similar. In a strep test, they go like, they want to meet your stomach with a strep test, it feels like. And then, so that's one of the swabs. The other 2, one in each nostril, and it goes deep. The reason that they have to go deep, it's not because they're being jackasses and want to make you uncomfortable and miserable. It's because that's where this particular virus lives in the body. That's not the only place it lives, but that's, I mean, they can't like cut open your stomach and swab you like that. So that's the easiest way to do it. Speaking of the point of care test, we're going to talk about in a little bit too. Just while we're talking about testing, I want to mention that. And also they have asked again to please postpone elective surgeries and procedures for now. And the reason for that is because when you have those, and y'all, I'm talking about medical and surgical procedures. They even included dental in this. If you don't need to have a dental procedure, don't have it. If you're on the schedule to have a boob job, please wait until all this is over with. Trust me, when you're recovering from a surgery or a procedure, depending on how serious, but like if it's a boob job, you do not want to get COVID-19 when you're recovering from a boob job. That's not the reason they're asking people to delay these elective procedures and surgeries. It's because when you have that done, even if it's a dental visit, if it can wait, please wait, because the providers that care for you have to use PPE, personal protective equipment. Now, if you go to get a dental cleaning, it's maybe a hygienist and then the dentist comes in. But still, every single piece of PPE that can be spared to be sent to the front lines of this needs to be spared. Now, I'm sure you understand too, well, maybe not. I mean, maybe you haven't had a surgery or procedure. I hope you haven't, but I have had enough that let's talk about the exploratory laparoscopy. I had to see to like double check, make sure I had endometriosis and remove it if they needed to. So I know there were 2 people who wheeled me on the gurney into the OR. There was the anesthesiologist. There was the anesthesiologist assistant. There was my surgeon. There were 2 nurses. And I think there was at least 1 other person. So, and that was, that was an outpatient procedure. It was nothing major, but that was 8 people. Just I'm sorry. Yeah, it was 8 people for me to have that surgery. Now, that wasn't an elective surgery. I will tell you that. I was miserable, in a lot of pain, having a lot of issues, and my doctor was like, "All right, this is we have to do this." And thankfully I had it done because they found what they were looking for. They sliced it out. Then I had complications, another video. We're not going into that right now. But like I said, even an outpatient procedure, I mean, like I said, for mine, it was 8 people. That's 8 pieces of PPE, and that's if they can use the same one through the whole process. I'm not going to pretend to know what are the conditions in a surgery that they have to change PPE. I don't know that, but I do know that was 8 people for one outpatient surgery. So if you don't need to have a procedure right now, please postpone it or cancel it. Call your doctor. Obviously, don't just like not show up, but let them know. Doctor or dentist. You know, they did specifically mention dental today too. Then Dr. Fauci came up. People are giving the task force a really hard time because they think that it's overkill what's going on in New York and LA and Washington in terms of, you know, don't go out unless you absolutely have to. And then Sunday night at 8 o'clock in New York, I don't remember right now what LA and Washington State are doing right now, but I do know in New York, Sunday at 8 o'clock, after that point, if you are not an essential worker, talk to your company to find out if you're an essential worker. I don't know for sure, but from the list I read, it's like people who make modern civilization run. So logistics companies, shipping companies, doctors, pharmacies, grocery stores, utilities, Wi-Fi, and that kind of stuff, because that's what things run on it so much now that has to stay on. So people were talking to Dr. Fauci all the time about and asking all the time, aren't these draconian measures too much? Well, no, and I'll explain why. This is kind of what he explained earlier. The outbreak in New York City, in Los Angeles, in Washington State is different from the outbreak that they're seeing in other places in the US. Now, what do I mean by the outbreak is different? I don't mean it's a different virus strain. I don't mean it's a different virus. What I mean is the way that it's spreading through Washington State, Los Angeles, New York City makes it so they really need to clamp down. It's almost like when you have a grease fire on your stove. Have you guys ever had a grease fire on your stove? It's not a fun thing to deal with. And a fire extinguisher is probably the best thing to get it out with, but that's a mess. So what my grandma used to do is take a pot lid and put it right down on that fire. So that's what they're trying to do in New York City, LA, Washington State. They're trying to put a lid on this thing before it gets much worse. You guys can look up the numbers from New York City, all the numbers, the new infections, the deaths, the recovered. You can look up all those numbers in LA and Washington State. But people are giving Dr. Fauci a hard time, and this is why they need to do those draconian measures. They need to put a lid on the fire that is this viral outbreak, viral infection outbreak that is just running rampant in New York City, LA, and Washington State. And like I said, it's day 6 of 15. So of all of us supposed to try to stop the spread. So they need to get those, the infections in those 3 places under control. So that's why they have moved to these extra measures. All right, next. Oh, he did repeat, not everyone needs a test. Not everyone needs a COVID-19 test. They have said numerous times who needs one, and that's if you're showing certain symptoms and you believe you have been exposed to it. Now, this is kind of a tricky thing. I know with me, some of the symptoms that they talk about being common in COVID-19, you know, I made a joke about this the other day. That sounds like Wednesday to me. Like, that's okay, how am I supposed to know? But there seems to be some hallmarks, but it's not just one thing. So if you have a fever, that's the main thing they're testing for now, because that is a hallmark of infection in your body, is a fever. But infection in your body is not the only reason that you might have an elevated temperature. But if you have fever, and by the way, look at my feed yesterday or the day before. There was a post that I put up. It's an image. And I believe I put some text with it too, that one of my neighbors contacted her doctor and said, kind of asked, what symptoms do I go to the ER for? And one of the symptoms that he put was like a ripping feeling when you cough. I don't remember the other one that he said, but there was also there a list of, if you have this, don't go. Those are not the symptoms that you need to get a COVID-19 test for. These are. So one of them was a ripping sensation when you cough, and I am pretty sure by that description, you're going to know if you have it. So yeah, just kind of look at those things. But one of the main things is with this, and it's kind of difficult, is sometimes you won't know if you have been exposed to it. Person to person spread, you might, because, if your cousin that you just went to dinner with 3 weeks ago tested positive, you might have been exposed to it, not to scare anybody, but that would be kind of a more probable situation. But because there's community spread too, and we talked about that yesterday, what that means does not mean it's airborne. I got to keep saying it. Living in an aerosol version and airborne are not the same thing. But yeah, the community spread is kind of making it difficult. Community spread, just real quick, means that they can't really trace back where it's probable that you picked up COVID-19 from. So, but not everyone needs a test. We're going to talk about that. And let me just talk about this real quick, because it's part of that, but it's important to state too, because we've all heard it. The personal protective equipment, the PPE, is... I don't want to say in short supply, but I will say it is incredibly important right now. It is needed. In some places, it is in short supply, but they're working on getting it. But yeah, if you can avoid anything that would make a healthcare worker consume, they call it consume PPE, or you consume PPE, that's another thing too. People who go to get a COVID-19 test, they're given a mask, and they're given other, and the healthcare worker treating them is given the same. So that's why it's important that not everyone gets a test. There's been a lot of misinformation about that as well that we're going to talk about, because someone asked me, kind of panicky and yelling, not asking, everybody needs a test. We need to do this. Why aren't we doing this? They did it in South Korea or whatever. So I'll explain. Let's see. There was also another thing that I thought was interesting. A lot of people have probably heard the Buy America thing. Under the Stafford Act that was kind of put into motion, not that it was just passed, it was passed in 88, but it's kind of, okay, here we go. We need the Stafford Act right now. There's a major disaster. It's a public health crisis. Because that has been invoked, the Buy America thing, it doesn't count right now, unless you're in Washington, D.C. or you're in Puerto Rico. So in that case, the hospitals do need to buy American when it comes to this stuff. But they can source masks from wherever they can find them right now, basically, because of the Stafford Act. So that's pretty amazing. Now they've expanded the possible suppliers of these masks. Not only that, but like I said, Hanes is retrofitting their factory to produce masks. And also Monday, I'm going to get information from one of our marketing clients who is an automation robotics integrator. And he's going to kind of tell me what retrofitting a factory kind of means, what it looks like, what's involved, what's the effort there. Because I thought that would be kind of interesting to know. We keep hearing, distilleries are making hand sanitizer now instead of the drinking alcohol. And we heard about Hanes retrofitting. So we're going to learn more about that Monday. And Ben Carson from HHS was speaking. I've never had a mortgage, so the terms and the acronyms, yes, I've heard them, but it's not like if they were written on a piece of paper, I could be like, oh, okay, this is what you need to do. But what I will say is contact FHA if that resonates with you, you're involved with that. And if you have any issues taking care of your mortgage, because it's not automatic that they will help. They won't reach out to you and say, hey, amidst this COVID-19 thing, do you need help? You need to reach out to them. You guys still there on the live? Oh, good. Okay. I clicked off for like 2 seconds, but okay. Sorry about that. I don't think I can show you the video of the drive-through testing, but I will do it tomorrow. Tomorrow I'll share the screen so you can see it. And also tomorrow, like I mentioned earlier, we're going to lighten up a little bit. A lot of heavy information. A lot of it is difficult to hear. A lot of it is scary. But with my DJ background, I went through some songs. Remember, early on, I said, you know, I've been doing this hand washing and sanitizing for a long time, so I'm familiar with making sure I do it for long enough. And I sing a disco song in my head. But if you're not a disco fan, that's okay. I went through my old DJ CDs. I counted beats per minute for you guys. I figured out easy songs to sing in your head and which part of the song or the introduction or the rhythm or whatever it is, the bass line, whatever it is to sing in your head. Whether you're old enough like me to remember when It Takes Two came out and it was new, right? That might be a fun one to sing in your head. Or let's see, let's tease another one. Maybe, oh, I mentioned Ladies Night before by Kool and the Gang. That's one I always use. Maybe a little classic rock, maybe a little 80s, maybe some newer stuff, like maybe Uptown Funk. We'll have to see. I don't know. But there's quite a few songs that you can choose to sing in your head. Whatever resonates with you, whatever sounds good to you. I have timed the different parts of the song, and I've found some that are at the 20-second mark or 20 to 25 seconds. And I've also found some that are like 30 to 35 seconds because I don't know. I personally want to make double, triple, absolutely quadruple sure that I'm doing it for long enough in this particular situation going on. Yes, I touched my face. I washed my hands before I came in here. So, and I haven't touched anything that has not been sanitized today. So, and I did it again. I have to stop. All right. So let's get to some of the other topics. Gracious. I've been talking 42 minutes and I have so much to cover. Let me just talk right quick about the New York State press conference. Okay. So those of you who know me, I used to live in upstate New York for a big part of my life. I moved out to Phoenix in 2007, and I am not a fan normally of your current governor, but when I was kind of coming up in upstate New York, his dad was Governor Mario Cuomo. I'm sure you guys remember him when we was youngins. I don't remember how young, but I don't know. But anyway, and the reason I'm bringing this up, I don't like to get political because I know it can go one of many, many ways, and I'm not trying that. So, somebody did ask me, do you think my governor is doing a good job? And that's something that I'll address later. But I did want to say, I really do think that Governor Cuomo of New York has got his arms around this thing. Just knowing that I've written a press release for people, knowing that I've given PR advice to people, knowing that I've been in front of crowds of people when I'm being video recorded and there's a bunch of people in the audience and you're speaking on a topic that you know and you're familiar with, but there are so many numbers and stats and this and that and years and dosages and all that in my case. I have to say, I think New York's Governor Cuomo is doing a hell of a job. He's got his PowerPoint behind him, but for the most part, he's rattling off the numbers. He's rattling off the information. He is trying to source masks and gowns and PPE from anywhere he can. He's trying to source fabric to make the masks and gowns from anywhere he can. Worldwide, he's making these calls. Obviously, the situation in New York City is not great, but I really think New York State is in good hands with Cuomo. De Blasio, that's another topic we're going to look at later. But yeah, I just, it's a difficult job. It's not just the toll and making these decisions that affect thousands and millions of people, life and death decisions. Like, many of these decisions every day. And I think he's doing a good job. And I was beyond impressed yesterday when at the press conference he had on a slide that I will take full responsibility, or I take full responsibility. In any case, a politician put up a slide behind themselves in writing, said it verbally, I take responsibility. Now, I have some politicians on my better half side of the family, and for a politician to say, I take full responsibility, I almost fainted. It's a good thing that he did say that. Now, like I said, de Blasio, we're going to talk about that in a minute. But to me, the fact that Cuomo said that, it was written behind him, and the other things that he had said yesterday, he's not thinking about he's not thinking about his career after this. He's thinking about, this is something I need to handle now. I'm doing the best I can. If I don't do well enough and I don't get elected, I hope that doesn't happen, but I got to make these decisions. I got to take responsibility. It is what it is. So, all right. Let's talk about something that was mentioned in the press conference. What does anecdotal mean? So Dr. Fauci was, and the reporters were asking about President Trump saying the hydroxychloroquine with azithromycin. He had tweeted it earlier. Kind of, it shows promise, looks good, whatever he said exactly. And Dr. Fauci was saying we have some anecdotal reports that show that. Like we talked about yesterday, and I'll talk about it just for a minute later, Dr. Fauci and President Trump are coming at this information from different perspectives. Dr. Fauci is a scientist. He wants data. He wants proof. He wants repeatable results. And President Trump wants to give us hope. Now, President Trump is not giving us false hope. We talked about that last night, right? With me and my fibromyalgia. I've been given over 60 drugs. Every time they gave me something to try to help me, it's not that they were giving me false hope. It's that they were making decisions on giving me medications based on the best information that they had. So, the anecdotal information that he's talking about, I'm not looking up a dictionary definition. I'm telling you what I understand it to be and in my experience. So an anecdote is like a story, is information from a point of view. So anecdotal information when it comes to medication is like not really scientifically, I don't want to say accurate. Remember the other day when I talked about, there were 40 people that showed promise with a hydroxychloroquine, and based on, certain things and margin of error. So like in marketing research, if you have like 1,000 people respond to a survey, within, I think it's 3% margin of error that it will be applicable to the rest of the population. If you have, what is it? Is it 700? Like 700 or whatever it is, then it will be 5% in error compared to the rest of the population. So the anecdotal information is not scientific. It's basically, okay, so, let's say that I had COVID-19 and I was given hydroxychloroquine. Wow. Go me. I'm not tongue twisted tonight about it. And it worked for me. So I say that. It was not like I was in a clinical trial for it. I wasn't in a scientifically accurate results producing environment. When they do clinical trials, they have very specific guidelines for, okay, we're looking for patients who, okay, let me give you an example from my real life. They were doing a study about chronic pain, and they said, okay, do you have chronic pain? Yes, I do. Are you this old? Yes, I am. Do you take this particular medication for your chronic pain? Yes, I do. Okay, you don't qualify for this study. Now, another person, it would be, do you have chronic pain? Yes. Are you this old? Yes. Do you take medication? No. There was one for knee arthritis that they had called me about. I don't have knee arthritis, so I didn't qualify for that. But anecdotal proof is not scientific proof from a clinical trial. It's, I was in the hospital, I had this disease, they gave me I had COVID-19, they gave me hydroxychloroquine and azithromycin together, and it helped me. That's what anecdotal means. It's like a story from my point of view. Not story as in it's probably not true. I mean, story is in something that I have to tell you about my experience. So that's basically what anecdotal means. But Dr. Fauci, he's a scientist and he wants data, as much data as he can get. When I was in marketing research, a marketing research analyst, and sometimes I still am, we want as much data as we can get, because the more data that we get, the more accurate the information that we find in our research will be when applied to the whole population. So they only had 40 people, and I'm not saying only because it's not promising. I'm saying only as in numbers, not promise, not what do you call that? Accomplishment. I don't mean it that way. I mean just 40 people. Let's say that, just 40 people. But you can't take anecdotal information about 40 people and say, okay, the millions of people that may be exposed to COVID-19, this will work for it. That just doesn't make sense, right? I mean, if you know 50 people, you know there are a lot of differences in those 50 people. So you can't make judgments on the whole population based on that, right? Because 5 of them might be overweight, 10 of them might be allergic to chicken, so that kind of thing. There's just not enough people. But if you have a clinical trial, a scientific study, and by the way, because COVID-19 is around the world, the population that they can pick from for the studies, if they can get that anecdotal information, it's not scientific, but it might show there's a better chance that this will work. But let's up that example. Okay, now we're not going to talk about 50 people you know. We're going to talk about 50,000 people you know. If you know 50,000 people, of those 50,000 people, 10,000 are obese or overweight, and 15,000 of them are allergic to chicken, then you can say, okay, wow, so there were a lot more people that in this universe percentage-wise had this same issue. If you have 500,000 people, you can see where, okay, we're able to replicate this between having 50 people, 50,000 people, 500,000 people. So the more people that you have and information you can get about them, from them, all that data, that gives you more accurate information. So anecdotal is just giving your experience about something, pretty much. Think of like when you tell an anecdote. I know it's an old word. I'm a writer. I know old words. Okay, what does a ventilator do? There has been, in the media, I've seen it several times. They're using ventilator and respirator. They're exchanging the terms. They're using them interchangeably. That's not accurate. Respirators are, you can think of them like the masks that everyone is talking about. A respirator just goes here. It's just like the masks. And I mean, there's another kind that can kind of go over the head and kind of do the same thing. But for our purposes here, a respirator is a mask, okay? A ventilator helps people who need it breathe. And it does that by introducing oxygen into the body and taking out carbon dioxide. That's probably the easiest way that I can explain it, but it's very important to understand the difference between a ventilator and a respirator, because a respirator, it doesn't sound all that different from ventilator. So is a respirator also a machine, and do we have to worry about them running out? And no. Respirators are like masks, and we are working on getting more of those. People are donating them. Like I said the other night, 3M and Honeywell are upping production. So a ventilator is a machine that helps somebody breathe in the hospital. Usually in the ICU. I should be a little more specific. So remember, ventilator is a machine with hoses, introduces oxygen in, takes carbon dioxide out, helps support someone's breathing. So that's the difference. I know that wasn't very scientific. I'm not trying to get all that scientific. I just know the basics. So there you go. Okay, the point of care COVID-19 test, let's talk about that next. Then we'll talk about the IgG immunity test. Then we'll talk about your questions. And I'm probably going to go past 9 o'clock. No, it's 8:57 now. I'm definitely going past 9 o'clock. Okay. The new point of care COVID-19 test. Let me pull up the article because I did see it, look into it, but like I said, I didn't have enough time to really dig into it. Oh, the whole article is here. Okay, I thought I just screenshotted the different paragraphs. Screenshotted? Screenshot? Screenshooted? I don't know what it would be, but whatever it is, I'm not saying it right. All right, guys, I always give you my source. I kind of owe you a few sources, don't I? Okay, obviously the White House and the New York State press conference information, I personally watched them myself. What does a ventilator do? That was on a website that explains different machines and comparing a respirator to a ventilator. I'm sorry, I did not save the actual website. Let's see. Yeah, I didn't save the actual website. I apologize. That's my bad. I normally do. Anecdotal, that's my experience being a medical patient and understanding, when I tell my doctor something about a medication, it doesn't mean it's that for the whole population and universe of people. It just means my experience. And, my source for that is my marketing research knowledge and experience, which is over, almost 25 years. So, okay. All right, so the point of care COVID-19 test. Y'all, this is super exciting because it can give results in 45 minutes as opposed to much longer. The video from the beautiful young woman who went through the drive-through testing center in Philadelphia that I'm going to show you tomorrow, I believe she was told 6 days it would take for results. I know in some places they tell you 3 days. In some places it could be longer. It just depends on that stuff. But the FDA greenlit the first 45-minute point-of-care coronavirus diagnostic test. I'm just going to read through this right quick. Clinics and emergency rooms can test a sample for the disease in about 45 minutes. Developed by, I'm going to say it, Cepheid. I apologize if I'm saying that wrong. The test is built to run on its automated GenExpert hardware with more than 23,000 tabletop systems installed worldwide and over 5,000 in the US. Okay, what that means is these people called GenExpert have hardware developed by Cepheid. The test is built to run on its automated. Sounds like GenExpert and Cepheid, I don't know how to say it, are somewhat related, but there's this hardware. There's more than 23,000 pieces of this hardware worldwide, over 5,000 in the US, and that's where this test is run. Okay. During this time of increased demand for hospital services, clinicians urgently need an on-demand diagnostic test for real-time management of patients being evaluated for admission to healthcare facilities, said Cepheid's Chief Medical and Technology Officer, David Persing. So what that means is they should wear PPE when they encounter this patient anyway, if they think that they have COVID-19. And I'm sure they're all wearing PPE right now anyway. But they can do this test on the person. In 45 minutes, they'll know if the person has COVID-19 or not. And if they don't have COVID-19, depending on what else they do have, the healthcare workers that are caring for that patient might not need to use all the PPE that they would have to use if the person had COVID-19, if that makes sense. If it does not, drop a comment or something. I will further explain. I'm just trying to get through everything tonight before it gets too late. Yeah, so he goes on to say, an accurate test delivered close to the patient can be transformative and help alleviate the pressure that the emergence of the 2019 nCoV, COVID-19, outbreak has put on healthcare facilities that need to properly allocate their respiratory isolation resources. So yeah, and then if somebody does have COVID-19 after this 45-minute test, they find out that the person is positive for COVID-19. Not only is the PPE not necessarily needed, it depends on what else they may have, but in this case, if we're talking just about COVID-19, then the ventilator wouldn't be needed, and they wouldn't have to think, okay, well, if this patient goes south, we're going to need a ventilator, because in 45 minutes they will know if that is a possibility coming down the pike or not. Pike or pipe? I've always heard it pike. Might be pipe. I don't know. Sounds good both ways to me. Okay. The FDA's emergency use authorization. Okay, that's good. The company said it plans to begin shipping the test this week and is concurrently pursuing its approval in Europe. Okay, that's wonderful. That means they're going to get these tests out there as soon as they can in the US. Looks like shipping this week, and then as soon as they get approval in Europe, they'll go there and they'll send them there. Key milestone, says the FDA Commissioner Scott Gottlieb. Yep. We need other point-of-care tests like swabs that give readable results. That's very true. Cartridge-based design. Oh, okay. So this is kind of interesting. It's a cartridge-based design containing all necessary reagents. Is similar to Cepheid's previous diagnostics for influenza and respiratory syncytial virus, and accepts nasopharyngeal swab samples as well as nasal aspirates and washes. So that basically means the swabs that I was talking about earlier with a drive-through testing there at the end. And then the cartridge-based design contains all the necessary reagents. Okay, I don't know a whole bunch about this, but what I do know is when they're trying to figure out if you have a certain disease or infection or condition, there are things that they add to your blood or saliva or whatever called reagents, and depending on what that shows, they can tell if you have a certain disease or condition or infection or virus or not. A good example of that from everyday life, if y'all have ever watched Cops, which I'm sure you all have, you're my people. Oh, not that I've been on it. I'm not saying you're my fans of my episode, but you know when they pull somebody over and they find a mysterious white powder, and the cop goes and he gets the little test kit, and then he puts some of the white powder in, it turns a certain color. Whatever was in the tube where the cop added the white powder, that's a reagent. I'm a big Miami Vice fan. If you've ever seen Miami Vice, I'm showing my age right now. They've shown that a lot, where like they go to pick up the bag of drugs and then they cut it with a folding knife, and then they scoop some out, and then they put it in a tube and they shake it and the tube turns blue, and they're like, primo. So that's basically what a reagent is. Now, of course, it's not the same thing as they would use to test like cocaine potency, but a reagent pretty much acts that way in this case as well. They're just looking for other stuff than drugs. Well, yeah. Than illegal illicit drugs. Okay. The test is designed to detect both current and future variants of the infection. Okay, so what that means is if the strain mutates again or somehow changes, this test will still be able to identify the virus. Our automated systems do not require users to have specialty training to perform testing. They are capable of running 24/7, with many systems already doing so today. Okay, that's awesome. Automated, don't need special training, running 24/7. There's over 5,000 of the pieces of hardware in the US that is needed to run this new point-of-care COVID-19 test that delivers results in 45 minutes. This is an awesome thing. I mean, I've had blood tests that have been around since like Moses was in short pants, and it takes days and days to get results. So I'm familiar with this process. Obviously, with a very infectious virus or a very contagious virus, like coming around the US as if it owned the place, yeah, you really need to get test results as soon as you can. So this is an amazing thing. All right. That is the news on the point of care test that the FDA has greenlit or approved. So that is very good news. That's very, very awesome news. Okay, let me take a little sip of my water here. We're going to talk IgG immunity tests, then we're going to talk questions, then I'm going to get up out of here because I got to do some dishes and get my house together because our marketing clients, we've been very busy for them the past few days, making sure that their clients and customers and employees and everybody have all the COVID-19 information that they need. So I haven't been doing a whole lot around my house lately, and I got laundry. We're not going to talk about how much laundry I have to do. But what we are going to talk about is an IgG immunity test. The reason I wanted to talk about this, again, if you're just joining, I wanted to talk about this IgG immunity test social media post that's going around. It's a sponsored post, so it is from a company, from a lab. Well, I'm sorry, let me take that back. It's from a company. I don't know if they're a lab. I don't know who they are. It sounded to me like they were a specialty lab, and they are kind of advertising, you should get this IgG immunity test now. See if what your immunity is, blah, blah, blah. Well, it was basically, obviously, to see if someone is immune to COVID-19. That's the point that they were getting at because of the timing, because of the urgency, the way it was written. That's what they were getting at. Now, I have a couple issues with this. Number one, and I commented on their post. You better believe I did. One of the problems with this is we need our labs right now for other things. We need our labs as free as they can be to run COVID-19 tests right now. I'm not saying immunity is not important. I'm not saying the IgG test is not important. I have had one to see if I had a particular virus. So it is an important test to have, and it's good to know your results. But what I said there is, look, if you think that you have an immunity issue, be careful. Just assume that you are at least a little bit immune compromised and act accordingly. You don't need that IgG test right now to implement things that you would if you knew your test results and they said that you did have some immune difficulties. So just pretend like you got the test results back. They said you do, and act accordingly. Don't tie up our labs and our doctors right now with that. So that was one issue with it. My other issue with it is IgG. Okay, let me get out some test results because I want to explain this to you. Going through my folder of my most recent medical stuff. All right. By the way, shout out to my primary care provider. Shout out to my pain management doctor. Shout out to all my doctors, all my nurses, all the doctors and nurses that are friends of mine that are watching this, stumbled on it in a public, whatever, wherever you found it. Man, shout out to you guys because, I mean, even before this, you guys do an amazing job and you do things that, and you're exposed to things and you have to clean up things and you have to make decisions that a lot of us couldn't even imagine having to deal with. So shout out to all of you guys. All right, so these are some lab test results of mine. The doctor did there's more pages and more pages. The doctor did a full workup. Doesn't matter right now why, but what does matter is that part of that full workup was IgG as it relates to Epstein-Barr virus. Now, also on here are my cholesterol levels. Also on here are my vitamin B12 and folate levels. I don't really think you can do anything fun with that, like steal my identity or anything else that might harm me. So I'm going to show you this page. I did cover up the results, not because I don't want you to know what the IgG and Epstein-Barr results are, but because I put a post-it note somewhere on here. Okay, so I'm going to explain IgG and IgM because IgG by itself, from my understanding, means more. IgG means more when you have IgM as well, and I'm going to explain that. IgG is immunoglobulin G, and IgM is immunoglobulin M. Now, what they do, and with fibrofog, sometimes I get things backwards, so I am going to make sure that I read it. It's not a blank screen. Why does it look like a blank screen? That looks like I'm reading a blank screen. There it is. Because I want you guys to know, like always, everything is sourced. Everything is accurate that I tell you. All right. just directly reading it. This is from a website called Kids Health, though I did go on another one for more specific and detailed information. IgG is the most abundant type of antibody. It's found in all bodily fluids and protects against bacterial and viral infections. IgM, which is found mainly in the blood and lymph fluid, is the first antibody to be made by the body to fight a new infection. So, what does that... Oh, wait. I closed my pictures. I need them open still for the rest of the video. Sorry, guys. Okay. So what does that mean, really? Let me show you my results, and I'll explain it. So let's look first. I'm going to try to do this. Y'all can see my cholesterol. It's pretty good, right? So, IgM. This was a test for IgM. I'll show you guys here closer. IgM for Epstein-Barr virus is what's on this first line, okay? IgM takes about 2 weeks for it to start showing in your blood test after a viral infection starts invading your body. So IgM takes about 2 weeks to show up. IgM is an antibody. IgM is the initial response to a virus. Primarily, it's the initial response to a virus that comes into your body. I'm trying to make sure everybody can see this. So, my source for this is my lab, and I asked my doctor to, hey Celia, I'll write to you when I'm done. And I asked to have this explained to me, and I looked it up myself because I wanted to make sure I understood. The detailed explanation that I'm giving you now is based on me looking on a lab test results information website. It's like, honestly, it's like labresults.com.au or something like that. By the way, in Australia, IgM and IgG mean the same thing as they do here. Australia? Austria? Whichever the .au is from, means the same thing. So, IgM antibodies take about 2 weeks. IgG antibodies take several weeks. And they come out because the body has been fighting the virus. And when those IgG antibodies come out, the easiest way to think of that is, phew, we got it. We got that viral infection. Let's remember that nasty critter. So the next time it tries to set up house in Ginger, the Pain Warrior Princess, we don't let that happen. We don't want that nasty old thing in here. She was really sick. She was miserable. We have to stay strong. We are IgG. We don't let that happen. But initially, when a viral infection comes into your body, it takes about 2 weeks because your body is like Jeffree Star. When it first comes in, is like, we don't know her. Y'all know Jeffree Star. We don't know her, right? And then in about 2 weeks, the IgM antibodies start to be plentiful and they can be read on a blood test. After several weeks, you get IgG antibodies, and that is what protects your body from getting that same viral infection again. So, the IgG testing that was offered in that sponsored post, I'm not a scientist, I'm not a medical doctor, I'm not a nurse. I have common sense, and I know how to read. And I've had this test, and I've asked my doctor about it to explain it, and I've looked it up myself to make sure I fully understand what it means. I don't understand how a company can test for IgG antibodies at this point when it's marketing to people who are concerned they're going to get COVID-19, and they need to find out what their immunity is. Because what would they be testing the immunity for? Because remember, the IgG remembers a particular virus that you had, a particular viral infection, and the IgG represent antibodies against that infection. So if you haven't had that infection before, how do you have antibodies for it? That's another problem I have with that Get Your IgG Test sponsored post. Now, again, I'm not a scientist, I'm not a doctor, I'm not a nurse. If I'm understanding that wrong, please tell me. It makes common sense to me, but I don't know. So, that is IgM and IgG explained. Again, I would not worry about getting any kind of test like that right now. There are other things that they can test in your blood, like vitamin D. Vitamin D has an effect on immunity. But don't fall for that sponsored post. Don't fall for it, because I can show you right here. IgG means that you have antibodies toward a particular virus. And look, can you see? It says EBV on the IgG test. That means they tested me specifically for Epstein-Barr virus antibodies. You can't test somebody for COVID-19 antibodies and expect them to have them when the person hasn't been infected yet. And you're marketing to them to get that test so they can find out if they're immune to COVID-19. Do you see this like circle that's going on? It doesn't make sense to me. But anyway, oh, I didn't show you guys. You can see EBV. So the IgG test and the IgM test that was done was looking for a specific virus. And I don't see how it can look for a specific virus in your body and the antibiotics for it if you've never had it. But again, I'm not a scientist, I'm not a doctor. It makes common sense to me. Even if I am wrong, please don't run out to try to get an IgG or any other test right now if you don't need it. Let's keep our labs open for COVID-19 testing and essential things only right now. Okay, so we are down to your many questions. All right. By the way, if you do have any questions, there's still time to get them in today. You can certainly post them under any post about tomorrow's live that I make. That's where I'm going to look for them. Probably won't be online as much tomorrow unless like some big news comes out, but I'll do the live again tomorrow night. Like I said, we're going to talk about songs you can sing in your head that are between like 20 to 25 second segments, or like 25 to 35, maybe 30 to 35 second segments, to make sure that you are washing your hands for long enough, because it's boring as heck to stand there and count 1, 2, 3. So I made it fun. We're also going to do some recipes, and I'll just tease it now. You know, with a lot more people using hand soap now, I think it would be a good idea to know the hack I'm going to tell you about tomorrow, because we've all experienced at one point or another, even before this COVID-19 thing happened, that you go into a restroom and some supplies are not there. So we're going to have a fix for that tomorrow. Okay, let's go to your questions. These are in no particular order. Maybe some of them are the same or similar topics. I apologize. I did not have time to group them in any particular way. So yeah, they're not like that. Okay. Someone had asked about the deaths in Italy, because they're reporting deaths in men is twice as high as deaths in women that have COVID-19. No, I don't know why. In fact, epidemiologists who study this don't know why, but they are studying the information coming out of Italy. There's a lot of data coming out of there, so they are looking into that and trying to figure it out. Trump and false hope, we already talked about that tonight and last night at length. Somebody brought up, what do you think about Dr. Fauci's body language? Okay, I'm not gonna read the rest of the question because it's not objective. It's kind of an opinion given, but I'm gonna give my opinion. I don't want to read parts of questions that are kind of skewed or swayed in one way or another unless I think it's useful. I'm not about misinformation at all. Okay, Dr. Fauci's body language. Here is what I make of that, okay? And I'm going to try and make it so you can see me. Okay, if you're not familiar what this is about, some reporters are trying to make a thing about Dr. Fauci in the back after certain comments that Trump made, doing this. I don't think it was necessary for the president to make that comment, but he did. It's not my business. But let me tell you the rest of it, and then, because I think yesterday was the same thing. Or Dr. Fauci is like this. Or he's like this. Now, we already talked about the toll that this is taking on people, but I don't think that's what it is. And I also don't think it's what they're saying, that Fauci and Trump are at odds or whatever. I don't believe that. Here's what I believe. And this is based on my experience dealing with a lot of doctors, a lot of different kinds of doctors, a lot of nurses, a lot of physicians' assistants, a lot of all levels of nurses, a family nurse practitioner, registered nurse, FNP, CNA. I'll get my acronyms right. What I believe is that he's a scientist. He wants to get back to the lab. He wants to figure this thing out. He knows that he has to come out and do these press conferences because of the situation, but he would rather be where he can figure this out. I'm not necessarily suggesting that he thinks the press conferences are a waste of time. I don't believe that, but I do believe that it might get to a, well, I'm not going to say that, but yesterday when Mike Pompeo was at the press briefing, President Trump basically said, if anybody has any questions for Mike Pompeo, please ask them. He needs to get back to work, basically. And I really wish that they would do that with Dr. Fauci because, again, I don't know the man. I just know different doctors and nurses, healthcare professionals, and the personality of some of them. I really do believe he just wants to get back to work. He doesn't want to be part of the political bureaucracy, whatever that's going on. He just wants to go back to work. He wants to figure this out. That's my opinion. I saw you sprayed your mail the other day. LOL. Yeah, I did. You know why? Because I had a cardboard box that came. I had a package from China that came from Wish. I had a plastic package that came, and the news had just come out. Hey, it lives 3 hours on cardboard. It lives 2 to 3 days on plastic and stainless steel. So yeah, I sprayed my mail with rubbing alcohol. If you don't like it, you don't got to do it. But guess what? It made me feel better. So I did it. Didn't affect anybody else. Took 5 extra minutes. I took care of it. I let it dry. I brought it in. So now make sure if you want to use rubbing alcohol and stuff, please watch the video from yesterday because I did an experiment with rubbing alcohol, spraying it on different inks. It's very important information for you to have because it doesn't play well with rubbing alcohol. Sorry, I should say be more specific. Be more specific. I'm sorry. Isopropyl alcohol. Isopropyl alcohol does not mix well, does not play well. Let me put it that way. Don't mix it with stuff. Don't do that. Unless you're making hand sanitizer, which we'll talk about someday. Doesn't play well with certain inks. So make sure you watch that. But yeah, I did spray it. And honestly, I sprayed some of the paper mail too. And yes, some of the ink ran. I was very careful. I didn't want the inside to get messed up. But I don't know what the information is on paper. Was it overkill? Might have been. But it made me feel better. And I didn't hurt anybody. And I wasn't obsessive OCD panicking about it. I had a little bit of a concern when I was touching the packages. Mostly the one that did come from China, to be honest. But it was in a plastic package. But the other packages were in the box with that. In the cardboard. So yes, I did spray my mail and it made me feel better. So, you know, like I said last night, there are so many unknowns right now. There's so many things that people are scared of, and we don't fully know enough about this virus yet. We talked a lot about that last night, and go back and watch that if you want to understand more. So if you want to wipe your groceries with a Clorox wipe when you bring them in, you're not hurting anybody. If it makes you feel better, I say go ahead. But don't let it get obsessive. Don't let it put you into a state of dread. Don't like not go near the groceries for 6 days. Do what helps you feel better in this situation. That's the best we can do right now. Control what you can control. Like stuff like that. Like washing your hands, like using hand sanitizer, like not going out if you're not supposed to or don't need to, like all that stuff, okay? So what's our next question here? Did you get your pharmacy delivery last night? You know, if you weren't around last night, what had happened was I use 2 different pharmacies. One is very close to a certain doctor that I use. So that pharmacy went to either curbside pickup or delivery. And it's about half an hour away from the house where my doctor is, right across the street. And like Walmart, I get some stuff filled at Walmart. They had the drive-thru open. They had the walk-in, pharmacy counter open. They were like, all good, whichever. But yeah, the pharmacy that's about a half an hour away, one of my medications was supposed to be delivered yesterday at some point. Another one is supposed to be delivered Monday. No, I did not get my pharmacy delivery yesterday. And I was up until like 11 o'clock and they did not come. They normally come between 4:30 and 6:30 at night when they're going to. But I know that, this business had to hire, my pharmacy, the business that I'm talking about, had to hire a couple more delivery services to kind of meet the demand. And I'm not sure what happened. I didn't have information for the delivery driver. My pharmacy is closed on the weekend, so I couldn't call and check up on it. But what I'm going to do is call Monday morning and explain that I didn't get it, see if we can figure out what happened. And then what I'll probably do is drive to the pharmacy and use the curbside pickup, just because I don't want that to happen again. I want to make sure I have my medicine. I want to make sure I have everything I need so I can hunker down when the time comes if I need to. All right, what's next here? Okay. Somebody said, why are you so worried? You don't have any of the conditions they say are high risk. They're talking about certain conditions. Whenever they talk about high risk populations, they talk about certain conditions for the most part in adults, like heart disease and diabetes, and obviously lung issues put you at higher risk. No, I don't have any of those, but I do have, like I showed you earlier, there's an immune issue with the IgG, IgM thing, because I have had Epstein-Barr virus at some point. That's what the test results showed. That was behind the Post-it note. I am more susceptible to get it or to get sick, which I didn't quite understand from my doctor, because if I have antibodies for it, then why would I be susceptible to get it again? But it could be just that kind of virus, or the virus gets different. I don't really understand that part, but I do know what they told me. So, plus I have some other results from those blood tests that indicate a bit of an immune function situation right now. I have about 10 diagnosed conditions that cause different symptoms that kind of make me weak, not as strong as I would like to or should be, don't really have an appetite. But even just chronic pain itself, which I've been dealing with for 25 years, that causes decreased immunity. So no, I don't have those particular conditions, and I don't really want to go into the other conditions that I have, not really about privacy. I mean, I've talked about them in front of crowds of people, but I don't want to scare anybody out there. Like if they hear a certain condition that they know their mother has or that they have, I don't want them to be like, oh my God, now I'm really worried about this. But most of the immune issues that cause my somewhat decreased wellness immunity, remember, nobody has COVID-19 immunity unless they've gotten this virus and recovered. This particular virus, this particular strain of the virus and recovered. I'm trying to be very careful with what I say. Very careful, very accurate. But yeah, that's why I don't want to scare anybody, but that's why. But yes, there were things that showed up in the blood test. Now, don't think that if you don't have the things that are listed that you couldn't have decreased immunity or have an issue if you get COVID-19, because they're talking about, young people under 19 or even under 44. The ones under 19 that get it, even if they get really, really sick, they seem to recover pretty well. But the other ones, even the ones that had no health condition, like I watched a video with a guy from his hospital bed. He has COVID-19. And he said, I'm very healthy. I work out all the time. I don't smoke. I have a good diet. I don't drink alcohol. And this thing made me feel like I was going to die for several days, he said. And I'm not saying this to scare you. I'm saying this because even if you're a healthy individual, you could still get very sick with this. That's all I'm saying. Okay. What can't I use isopropyl alcohol on? Well, there are quite a few things, and I think it's so interesting that people who are unfamiliar with these products or ingredients, like I've been using them for a long time. We've always had rubbing alcohol in the house, Clorox wipes, always washing our hands, hand sanitizer, all that kind of stuff. But a lot of people have these products in their house just because they were like, everybody's buying them up. I gotta buy them. But they don't really know how to use them. So it's kind of interesting to me. Some of that information you can find in yesterday's video with the experiment I did about inks. There are certain surfaces, though, that you should not use isopropyl alcohol on. I do not even pretend to know a full list of those, but you might want to look it up if you have a particular surface that you want to use it on. Like if you have a marble counter, you can just search in Google, can I use isopropyl alcohol, and then put the percent, or put the percent before. Either way, it'll pick it up. Can I use 91% or whatever the percent you have, isopropyl alcohol on my marble counter? Then you can find out for sure, because I don't want to give you information that might not be accurate. Everybody's home has different surfaces and all that stuff. So, okay, here we go. They need to test everybody. What is wrong with them? And then it went on and on. But I had several thoughts that were kind of racing through my head, and I typed them in for this question. First of all, we've already talked about earlier why they shouldn't be testing everybody right now. Part of it is we need labs we need labs to be able, available, ready, which they are, I'm not saying they're not, but to process COVID-19 tests for people who have symptoms or believe they were exposed to it. That's primarily what's important. If you don't have symptoms, you should not be trying to get a COVID-19 test. And I'll explain that in just a second. The other reason, like we talked about, was the PPE issue. So we don't want our healthcare workers using PPE on themselves and on you if it's not necessary. So if you don't have symptoms of COVID-19, if you weren't potentially exposed to it, don't get a test. Don't ask for a test. And besides, even if the test is negative, even if the COVID-19 test comes back negative, that's a snapshot in time. That doesn't mean that in 2 days you would also test negative. It doesn't mean in 2 days you would test positive. It doesn't mean in 5 days you would test negative again. It's a snapshot in time. Same thing with a pregnancy test, right? Okay, I'm late. I'm going to take the test. At that snapshot in time, there were not the hormones in your urine to give a positive result. The next day, that might be different. 2 days from then, it might be different. 2 months from then, it might be different. So if somebody gets a negative test at this point, it's a snapshot in time. It means when we took your COVID-19 test, when we swabbed your snoot and your throat, that's what we found. I don't want to say it means nothing, but the truth is it means nothing. It really does. It means nothing. Just like the blood test results that I showed you. They did tests and tests and tests and tests. And at that snapshot in time, that's what the results were. That's what it means. But it is mostly about the resources at this point. Okay. And no, limited resources does not mean that someone has screwed up, does not mean somebody should have done something sooner. Please don't get into that. That doesn't help anybody right now. We're doing the best we can, and everybody is. So. Okay, so yeah, my note here was, even if it's negative, it means it's a snapshot in time that you were negative, and maybe you went out and thought you were okay, and you could have been exposed to somebody later that day that has COVID-19, was asymptomatic, is asymptomatic, didn't know they had it. So, and obviously, I mean, like I was saying, snapshot in time, you were negative. 2 days from then, you might not be. A week from then, you might not be. 2 months from then, you might not be. And you can't go back and get a test every 2 days. That's not how it works. It's not like a pregnancy test that you can get in the dollar store nowadays, so you can go snatch up 20 of them, take them home, and then feel free to pregnancy test yourself every day if you want to, till they run out. But we have resources that we need to prioritize in different areas. So no, everyone should not be getting tested. For my common sense reasons, for my understanding of what test results show, from what Dr. Fauci said, from what Vice President Pence said, from what President Trump said, from what the whole task force is saying. Okay. Let's see. Yeah, in my other part of my notes here, plus you would be using resources when you go, PPE, the human resources of the medical workers, the lab resources that we were talking about a minute ago, their time is a resource, of course, bed space. When you go in, it's not like they're going to be like, okay, stand against the wall. That doesn't really happen unless there's no room anywhere in the hospital, or the hospital that you would go to. They are, I heard talk the other day about a self swab. If they can develop one of those, that is going to be huge as well. But not enough news to talk about that on that front as of yet. And my eye itches. Thank you, allergies. Oh, mama. Okay. What we are seeing. Okay. Oh, I hesitate to say this one. Why won't you talk about the politics? What we are seeing now cannot be repeated. Okay, look. That's not important right now. It is what it is. The fact is that information that was coming out of where this originated was problematic, to put it kindly. It was very problematic. There were a lot of things that were going on that, not here, over there, that should not have been going on. Many, many things. So, if our government is not being given accurate information by anywhere and everywhere, every single country that has this COVID-19 virus, there's only so much that can be done. Things look very, I want to pick my words so carefully. In Italy, it's obviously a very, very serious situation. In China, it appears, with no new COVID-19 cases in 3 days, positive test results for COVID-19 from what I understand. It's difficult for me personally, understanding statistics and probability from my marketing research, knowledge, and education. It's a little difficult for me I have cognitive dissonance about that. Let's put it that way. I have a lot of cognitive dissonance about those differences. That's all I'm going to say about it. Other than, there will be plenty of time after this is all over for political discussions, for blaming, for all of that. We're going to talk in a minute because somebody said, do you think my governor's doing a good job? But I think it is completely inappropriate right now to do that. I won't do it. And I honestly don't think anybody else should either. And you know what? Here's part of it too. I am very even-keeled. And I am the person in people's lives that if they want to make a certain decision, I can tell them what might happen, might not happen, might come out of the decision. Here are other options you might want to consider because X, Y, and Z may happen, or A, B, and C may not happen, whatever's more important to you. I'm the person that people come to for that. So I have the ability to look at things from like the center, not politically center. I'm not saying that. I'm not talking about political spectrum. I'm talking about thinking on all sides, on both sides. And when I have said something that is not, I gotta word it so carefully because I know, okay. When I have said something that is not negative about President Trump, or that is positive about President Trump, or that is negative about President Trump, or is positive about a Democrat or negative about a Democrat, or not negative or not positive. Whatever I say, someone has called me something. I'm either a liberal bleeding heart. I'm a Trumpican. New word. But here was my answer, okay? I'm an American, and right now everybody needs to be an American. That's what I am. That's all that matters right now. I suggest you adopt the same attitude if you don't have it already. And I know all my friends and family on here are freaking awesome. And I know that you guys, that's not directed to you. That's directed to somebody in your life that you think needs to hear it. All right. Oh, my hips. Oh, goodness. My joints are getting stiff. Okay. Isn't it great what Hollywood is doing? Okay. So, sure. Let me qualify that. So, by the way, yesterday I saw an interesting video from Daniel Day Kim. If you're not familiar with him, he is an actor. If I remember right, he's on Hawaii 5-0. I want to say that. I know he made his video from Hawaii. So he was actually filming. This is like so interesting to me, how like coincidence and fate and all that. He was filming for a show called New Amsterdam, and he was playing a character that was a doctor who was brought in to help with a flu pandemic. Wow. And he got COVID-19. Not in the show. I mean, like, he got it in real life, but he was playing a doctor that was brought in to help deal with a pandemic. That was so interesting to me. And now he has a virus that's going around as part of a pandemic. But anyway, so Hollywood, yes. I've heard that some individuals are doing certain things. I don't want to mention any names because I'm going to forget half of the ones that I heard. But what I thought was interesting is that they were talking about, oh, the movie industry. They've even released movies early that you can get on demand and watch from home instead of the movie theater. Well, they're not free to watch, so they're still going to make some coin off of it. But yeah, I guess it's kind of cool if you were waiting for a certain movie to come out. Now you can watch it at home. You don't have to wait. All right, we talked about Dr. Fauci's body language. Let me just see if I have anything else to add to it. Yeah, I thought, in addition to what I said earlier, it's possible that he might be annoyed and he just wants to get back to work. He's in a hurry. He wants to get back to what he needs to do to kind of save the world. Bit important. And I had an example, when you're trying to get to work and you're late and there's a traffic accident, especially out here in the Phoenix area, it happens a lot on the freeways, and you just want to get to work. You're annoyed. You're sitting behind the wheel and you are pissed off that you can't just get to work and do what you want to do. I'm not suggesting he's pissed off. I'm not saying that. It's just an example that you can relate to. I don't know Dr. Fauci. I wish I did. I'd love to shake his hand. Wash my hands first, then shake his hand at a social distance, and then wash my hands again. That's how I would handle it. Okay. What about mail and paper and packages? We talked about that already. All right, next question. Now they're saying diarrhea is a symptom, and before they didn't. What are we supposed to believe? Okay. So, yes, as they gather more data about this viral infection, there will be more information coming out. There'll be some information added. There'll be some information taken away. My best advice is to keep up with this information the best way you can. Here, every night, I'm doing these lives. I'm answering questions. I'm going through the press briefings that happened earlier in the day and sharing information. I'm sharing posts on my feed. Now, as related to the specific symptom that they mentioned that is possible to see with COVID-19 being diarrhea, it makes common sense to me. When your body has a fever, when you're fighting a viral infection, weird things can happen. I mean, your body is trying to get this thing out of your system the best way it can. That's why you cough. That's why sometimes people vomit when they have this. That's probably why they have diarrhea too. I'm not suggesting if you're vomiting that is a symptom of COVID-19 and go get tested. Please don't think that. I'm not saying that. I'm saying once somebody is infected with COVID-19 and they are in the middle of the sickness, I have seen some patients that were interviewed report that they were vomiting. That's all I'm saying. Okay? If you puked once, don't run out and say you need a COVID-19 test. Okay? That's not what I'm saying. But when your body is fighting a viral infection, if you have never had one, or Honestly, I would probably say with a bacterial infection too, like a urinary tract infection, bladder infection, sinus infection. When that's happening, some weird things are going on in your body, and your body is just trying to get that invader out. Just like get out, whatever way you can. That's my understanding. And I know when I've had a fever, I've had stomach upset. All right. Why do we have to stay in for so many days? It's ridiculous. Well, you know what? Honestly, what's ridiculous is you saying something is ridiculous when there are 10,000 scientists and doctors working on this thing, and that's what they have told us we need to do, and they have the proper training and education and knowledge and experience to make these decisions, and you don't. Seriously, though. There's a long incubation period with this thing. It's very contagious. And you need to understand the spread that can happen among just one contact with somebody who has COVID-19 and doesn't know they have it, or are asymptomatic and don't know that they have it, or even have mild symptoms and don't know that they have it, or I know it's frustrating. I know we're on day 6 of 15, but just do what we're supposed to do. You don't need to understand the exact mechanics of it to do what you're being asked to do. Just know this is a very contagious virus. They don't know 10,000% beyond the shadow of a doubt exactly all the ways in which it is spread. It's got a long incubation period. People walk around asymptomatic with it sometimes. And one person, if they go somewhere and there are 500 people, and it can just get exponentially worse, and we are trying to avoid that. So please do your part. Okay, this is another one. Okay, this has been going on in the U.S. since November or December. I know it has. A lot of my family were very sick around that time period with very similar symptoms. I don't know that. I know that I was sick. I checked back in my feed. Well, I didn't check back. It kind of popped up an image that I knew was from Thanksgiving morning that had certain vitamins and supplements and medications, and I clicked it, and the text said, well, you planned Thanksgiving so well, and then you wake up Thanksgiving morning, or was it the day before? Whatever it was. And then you have to fight the cold. So yeah, I was sick around then too. Okay. I don't know if it's been around the U.S. since November or December. I don't. A lot of people get sick in November. COVID-19 symptoms are kind of similar to a lot of other things. So I don't know. I don't know, and I don't know if we'll ever know, and I don't know what the point of that is. What difference does it make? Well, okay, it might make some difference, but right now with the situation we're in, it's not important if it started here in November or December unless scientists, officials, doctors see a pattern that relates to that. But so far, there hasn't been a doctor, an official, someone from the task force to come out and say that. Oh boy. All right, this has been going on for a long time, but I really want to get to... All right, guys, I'm going to stop it here. It is so late, and I really need to get some stuff done. We normally start getting ready for bed in about 10 minutes, and I have some things I have to do. Many more questions came in, and they'll be answered tomorrow. If I didn't get to your question tonight, I am so sorry. I've been on here, an hour and 48 minutes now. But I will be back tomorrow night with more information, and we'll go from there. But yeah, keep sending me your questions and your information. I'll say it again. Please do what we're being asked to do. It's only day 16 of 15 days that we're supposed to do this. And if we do what we are supposed to, there's a very good chance that on day 16, our lives will be getting back to normal. So another thing that I want to say, I know a lot of people are concerned about stock in the stores. I have done some research into this. No, there's not a food shortage going on. There's just a TP shortage in the stores, but there are warehouses with it. So I really believe that in a matter of about a week to 2 weeks, most things will be back in the stores. Like they said earlier on the news, maybe not every single flavor of every single product, but because what they said is they're prioritizing getting the most popular things to the store. So there you have it. But I don't think we need to worry about that. But yeah, that's it for tonight. I'll be back tomorrow night with more of your questions, more topics to talk about. I always try to post by 4 or 4:30 what the night's topics will be, and then I run over quickly to YouTube, set up the event. So once you see those posts go up, give me about 15 minutes, and I'll have the event set up on YouTube, and then you can go ahead and set a reminder. So when I go live, you will be reminded. Okay, thank you so much, you guys on YouTube, for checking in. Thank you guys so much on Facebook for checking in. You guys have been so supportive and awesome and amazing and thanking me, and I'm just doing what I can to help right now. That's what it is. So I do want to make another offer as well. I did it in my neighborhood group. If you have a business and you would like help crafting, writing, or editing, or proofing, if you have one written already, a quick social media post about what your business is doing in the COVID-19 situation, or if you want a short paragraph written about that you can include in like a newsletter or a blog article, or something like that, like a quick announcement kind of thing written, let me know. It doesn't have to be something written that is meant to be published in writing. I can write it so it can be something you say if you would like to do a video to kind of, face-to-face talk to your customers. And I'll do that at no charge. I'll do that for as long as I can. Honestly, we're busy with our marketing company. I'm trying to keep up with this stuff. I'm trying to keep my health going, but I'm also trying to help anybody and everybody I can right now. So if that's something you're interested in, let me know. All right, guys, have a great night. Stay safe, stay healthy, stay inside if you're supposed to. Wash your hands. Anybody, everybody, all buddies, wash your hands. And I'll see you guys tomorrow night. Have a good night, guys. All right, YouTube land, have a good night. Thanks for joining, and I'll see you tomorrow night.